welcome. This video basically is just gonna be a quick rundown on how the medical system works and kind of how to work it. As it is simple enough, I'll just get straight to it. So starting off the bat, to access the medical menu, just hit up H on your keyboard and it'll pull up the medical menu and overview of it. Kind of simple enough. Starting from the middle here, we kind of have our body simulated with limbs, torso, head, and from there on, primarily depending on what limb is kind of hit, we also have different kind of opportunities to fix it. So just to keep it simple, we'll just, for example, select our leg and check out the options here on the top left. Basically, first off, starting with the triage card. Not really that useful right now. Examine the patient option gives us a couple of options as well to check the pulse. Right now we have a normal heart rate, and then as well blood pressure. And moving on, we're able to either bandage, depending on what sort of damage we've received to the body, bandage fractures, and as well under the bandage and fractures option, it gives us the option to apply tourniquets. Tourniquets in hand helps a lot with limbs that are bleeding. So with tourniquets, we're able to stop the bleeding of that particular limb. And also, it's a good thing to remember with tourniquets as well. Tourniquets are only able to be put on limbs such as hands and legs. I mean, of course, you wouldn't be able to put a tourniquet on your head. That would just choke you to death. But tourniquets are very simple on the limbs. And then as well, medication. With the same thing basically with the tourniquet is that medication, you're only able to give medication on the limbs. You're not able to give medication on your torso nor your head. So it's always a good thing to make sure that you've actually selected the right limb to proceed with the medication. Simple as it is. Morphine for pain. Morphine also has a side effect of lowering your blood pressure and heart rate at the same time. Primarily for pain, of course, morphine, but with morphine as well, it's always a good thing to keep in mind that it's viable for 10 minutes and so on. And then epinephrine, on the other hand, increases heart rate, which kind of counters the morphine's effect on your heart rate. So that's also a good kind of thing to keep in mind. And then advanced treatment. That's a category which primarily is used with the torso. For example, if we find a friendly that's down on the field and you go and check his vitals, you check if he has a pulse or not, and of course right now it shows that I have a pulse because that's obvious, but let's say he has suffered a condition where his heart has stopped. Once we select the torso and under advanced treatments, we'll be able to get the option to give that person CPR, which can kind of prolong the situation, or you're gonna prolong the situation that he might just die out of loss of heart rate and totally just die. And then you can also, depending on the person or player, you can drag or carry that said person if that person is on the open. in an open AO, and you kind of need to grab him and carry him to cover. That's the option right here. And then the toggle button right here basically differentiates you. For example, if you've opened up your battle buddies medical menu, you can toggle between his and yourself right here. Now, the bottom row right here shows the activity log and quick view. As you can probably see, as I checked my pulse here earlier, we can do that again to kind of show you. It shows up below here on what you've kind of done to yourself, so it's basically a list of what you've done. So my heart rate last time I checked it is at 80. And then the same thing on the activity log is basically, for example, earlier I placed down the tourniquet. The tourniquet activity log will basically just show that I put the tourniquet at this time of the hour. Same thing as, oh, and also with tourniquets, also good to remember that prolonged use of tourniquets will give your body pain. So always remember, once you've kind of stitched yourself or gotten yourself up into combat effectiveness is to remove the tourniquet, because at that point you don't need it anymore on your limb. Prolonged use of the tourniquet will give you pain. So as shown here, I'm currently mild in pain. Swell with the overview section on the right. Depending on what the situation is, let's for example simulate that I've gotten a gunshot wound in the torso. It will actually tell here if the torso has a velocity wound and if that torso is bleeding. But I'll show you more in depth here in a second. Basically, just to show you real quick, I'll use a guinea pig. We'll call him George. Basically, right now, George will be my example. So as simple as enough to pull up the medical menu. When you look away from anybody, you just press H, you pull your own medical menu, as seen at the top left. Now, if you were to run up to someone into close proximity, like George over here, and press H, you would actually pull up his medical menu. Although it does say my name up there right now because, well, it was my body earlier. But as example, we'll just call him George. Now the situation has kind of changed on the status and the limb pictures. We actually see that there are different scenarios. I have minor avulsions and medium avulsions torso. I have a large velocity wound on the head, and there's a medium as well. Same for the leg, is basically a minor puncture wound, and the left arm has a small velocity wound as well. Now we're gonna here to show you kind of how to fix them up. Now before that, looking at our inventory and what the medic kind of has on his body that are crucial to the medic's task of keeping up his squad mates in perfect condition. We have a couple of versions of bandages. We have the elastic bandage, quick clot, 10 bags of 500 milliliter blood, cable ties, epinephrine, 15, morphine, and then absolutely we're gonna need a surgical kit, and of course we're gonna need a tourniquet. In fact, we have 9 tourniquets as well. Now, to kind of talk about the different types of bandages, there is a picture on the manual that indicates on the different values of the different types of bandages. Right now we have elastic and quick clot. From what I've personally used as a medic is I've always used elastic bandage, as the values of the elastic bandage allows you to quickly heal up a wound or a limb. However, with the elastic bandage, let's say for example if I were hit in the leg and I just use an elastic bandage to heal it up, the elastic bandage would do its job quickly. However, if I were to keep running around, the elastic bandage has a higher chance of reopening. On the other hand, with quick clot, for example, quick clot takes a little bit longer to apply on a wound, but it has a higher value or a higher chance to not reopen. So it's a good thing to kind of keep in mind the values of different bandages and what they're worth. Of course, they're gonna have different reactions to different types of damage that you've gotten and received on your body. But primarily, I would personally just use elastic bandage for the fast value heal, and quick clot in scenarios where you might not have a straight up medic, or the medic's currently busy with something else and can't get to you, for the value to keep your wounds from not reopening. But just to show you a quick thought process on how to deal with the medical system and medical criteria or categories on who's kind of hurt most and who's not, it's always a good idea to prioritize your patients and how to deal with the patients. This is also a good example of if you have multiple damages to multiple limbs, on how to kind of prioritize them. So starting off, you always want to prioritize your torso and your head. Those two are your more vital limbs that, if not treated, bleed a lot faster. Of course, the bleeding also depends on how badly that particular limb is hit. But for this scenario, it is always good if, as a medic, you start healing someone and you see that, alright, this person has multiple damaged limbs. It is always good to tourniquet your limbs first. So tourniqueting your hands and legs will stop the blood loss on those. Alright, we've tourniqueted the limbs, and from here on out, start bandaging the torso. It's gonna take a while, but the more I use elastic, the more white it'll turn. Now, white in this case indicates that, alright, we've finally managed to bandage the selected body part that much that it's not bleeding. And then we'll move on to the second in the category of priorities. The second is head. We'll tourniquet that, or correction, not tourniquet, but bandage. It'll basically show you can bandage a body part until the point that it doesn't give you the option. At that point, you know that, alright, this body part is already clear. And then from the priority, we'll move to the tourniqueted limbs. Green, leg. Alright, now we've basically bandaged the body up. Now in this case, remember what I talked about reopening. Your limbs have the option or the possibility to reopen once they have been bandaged. In this case, you're gonna need to find a medic that has a surgical kit. With the surgical kit, I'm able to stitch the wounds of that said body so that they don't reopen. This is kind of crucial for the medic to understand, and for teammates to understand, is that once they bandage their limbs, they're gonna keep reopening and reopening unless they get a medic to stitch their limbs up. Once they've been stitched, from there on out, the wound won't reopen, and you won't have the issue of your wounds reopening and then you starting to lose blood again. And then once your body has been stitched, you can go ahead and just remove the tourniquets. And from there out, you're basically done. At this point, George is combat effective and he can go out and start helping out the team again. But in just short terms, that's basically how the medical system is right now and how it works. Simple ideas. Always start from tourniqueting your limbs, and then moving to the torso, head, and then back to the limbs and remove tourniquet. But that's basically it on the simpler terms. Thank you for watching.